Hey everyone, Alvin here from EasyMedics. Are you pregnant and finding yourself constantly thirsty, making endless trips to the bathroom? Or maybe you're just feeling overwhelmingly tired all the time. You might be chalking it up to normal pregnancy symptoms, but what if it's something more? What if it's a sign of gestational diabetes? And if it is, what does that actually mean for you and for your baby's health? Let's break it down and get you the answers you need. Gestational Diabetes Mellitus, which we'll call GDM from now on, is a specific type of diabetes that only appears for the first time when a woman is pregnant. It is a condition that develops when your body can produce enough of a hormone called insulin to meet the extra demands of pregnancy. Think of insulin as the special key that unlocks your body's cells, allowing sugar, or glucose, from your blood to enter and be used for energy. During pregnancy, your placenta produces hormones that can interfere with insulin's job, a phenomenon known as insulin resistance. For most women, their pancreas simply compensates by producing more insulin. But for some, their pancreas can't keep up. When there's not enough effective insulin, that sugar can't get into the cells, so it starts to build up in your bloodstream, leading to high blood sugar levels. It's incredibly important to understand that this is not your fault. It's a complex hormonal issue related to the physiological changes of pregnancy itself. Now, beyond the classic signs of increased thirst and frequent urination, there are other subtle symptoms you should be aware of. Are you experiencing a level of fatigue that feels extreme, even for pregnancy? Has your vision become blurry at times? Or have you noticed an increase in annoying yeast infections? These could also be indicators of Certain factors can increase your risk of developing the condition. You're considered at a higher risk if you are over the age of 25, if you were overweight before becoming pregnant, if you have a close family member with type 2 diabetes, or if you have a pre-existing condition like polycystic ovary syndrome, also known as PCOS. Knowing these risk factors can help you and your doctor be more vigilant. So, how do you find out if you have it? Diagnosis typically happens between the 24th and 28th weeks of your pregnancy through a routine screening called a glucose tolerance test. This process is pretty straightforward. You'll be asked to drink a very sugary liquid, which, fair warning, is not the most delicious thing you'll ever taste. After a set amount of time, usually an hour, a blood sample will be taken to measure how well your body processed all that sugar. If the results from this initial screening are high, your doctor will likely order a longer, more definitive follow-up test to confirm the diagnosis. If you are diagnosed with GDM, take a deep breath. The first thing you need to know is that this condition is highly manageable. The primary goal is to maintain your blood sugar levels within a safe and healthy range for both you and your developing baby. To do this, you'll need to become an active participant in your care, which includes monitoring your blood sugar levels at home. This is done with a small, easy-to-use device called a glucometer. Your healthcare team will show you exactly how to use it. Generally, the target for your fasting blood sugar, that's your level before you had anything to eat in the morning, should be under 95 mg per deciliter milligram d. After meals, your target will usually be under 140 mg dl when measured 1 hour after you start eating. These numbers are your guideposts to a healthy pregnancy. Your diet is, without a doubt, the most powerful tool you have in managing GDM. This doesn't mean you have to go on a miserable restrictive diet. It's about making smart, strategic choices. The focus should be on complex carbohydrates that have a low glycemic index. These are carbs that your body digests and absorbs more slowly, preventing sharp spikes in your blood sugar. Think delicious and satisfying foods like whole grain bread, steel-cut oats, quinoa, and various types of beans and lentils. A crucial tip is to always pair your carbohydrates with a source of protein or healthy fats. Adding chicken, fish, nuts, or avocado to your meal helps to further slow down the absorption of sugar into your bloodstream. Also, make sure to load up your plate with non-starchy vegetables like broccoli, spinach, bell peppers, and leafy greens. They are packed with essential fiber, which helps with blood sugar control and keeps you feeling full. And, of course, staying well hydrated by drinking plenty of water throughout the day is essential for your overall health and can also help manage your blood sugar levels. Now, let's have an honest conversation about medications. For many women, diet and regular exercise are enough to keep their blood sugar in the target range. But for others, it's just not enough, and that is completely and totally okay. It is not a sign of failure. It simply means your body needs a little extra help. If your blood sugar numbers consistently remain high despite your best efforts with lifestyle changes, your doctor will likely recommend medication. There are a few different options, and your doctor will help decide which is best for you. Number 1 is insulin. This is the most common, oldest, and most well-studied medication for treating GDM. It's considered the gold standard because it is extremely safe and effective during pregnancy. A key reason for its safety is that the insulin molecule is too large to cross the placenta, meaning it won't affect your baby. You'll administer it yourself through small, simple injections, and don't worry, your doctor or a diabetes educator will provide thorough training to make sure you feel confident and comfortable doing it. Number 2 is Metformin. This is an oral medication, a pill you take, that works by helping your body use the insulin it already produces more effectively and by reducing the amount of glucose your liver releases. Metformin does cross the placenta, which is something your doctor will discuss with you. However, numerous studies have shown that it is generally safe for both mother and baby. Some women might experience gastrointestinal side effects like nausea or an upset stomach, but these often improve over time. And number 3 is Glyburide. This is another type of pill that works by stimulating your pancreas to produce more insulin. Like metformin, it also crosses the placenta. While it can be an effective option, some research suggests it may not be as consistently effective as insulin or metformin for every woman, and it carries a slightly higher risk of the baby having low blood sugar after birth. Your doctor will weigh the pros and cons of each medication based on your specific health profile and blood sugar patterns. The entire purpose of treatment, whether it's through diet, exercise, or medication, is to prevent potential complications. Uncontrolled GDM can lead to issues like having a very large baby, a condition called macrosomia, which can complicate delivery and increase the chances of needing a C-section. It can also cause your baby to experience low blood sugar or hypoglycemia right after birth, which may require monitoring in the neonatal intensive care unit. Remember, a diagnosis of gestational diabetes is not a sentence for a difficult pregnancy. It's a call to action. You have the power to manage this. With careful monitoring, a healthy diet, and by following the plan you create with your healthcare team, you can absolutely have a healthy pregnancy and a healthy baby. You've got this.